So microinsurance is developing quite rapidly in many countries. We're seeing rapid growth in Africa, Latin America, especially Asia. Asia is where we're seeing the biggest volumes of low-income people having access to insurance. Growth rates in the neighborhood of 40–50% a year. And there's an estimate to be around 500 million people, low-income people, having access to some sort of insurance at this stage. So there's been some big progress has been made. This is up from perhaps 135 million just a few years ago. So very quickly, we've gotten to significant scale. So the private sectors really see this as a huge market opportunity. This is the Prahalad's profits at the bottom of the pyramid approach, where insurance industries historically have just served the top end of the pyramid. And now they're realizing that, in fact, there's billions of low-income people. In fact, Swiss Re estimated the market for microinsurance is 4 billion people. So over the past 5 years, if you look at the top 50 insurance companies, in terms of the size of those companies, in 2007, there were 7 companies that were serving the low-income market. This is self-reported data. And as of 2011, there were 33 of them. So all of a sudden, everybody jumped into the low-income market. It's not just, what are the insurance companies doing to serve this market, but is the market actually benefiting from that? And that's from the ILO's perspective, something we're particularly concerned about is making sure that people have access to relevant services to help them manage risk more effectively. So I guess you can look at the value for the customers in a couple of different ways. One is, how do they manage their risk more effectively? If they experience a shock, an economic shock, a death in the family, an illness, they're able to cope with that in a much more efficient way than borrowing lots of money in order to cover health expenses or to pay for a funeral. So it's an efficient risk coping mechanism. But we're also seeing some tangible benefits for, particularly related to health insurance, in terms of improved maternal mortality rates, child mortality rates, and even child labor, which seems a little surprising. But the idea is that one of the reasons why people take children out of school, families take children out of school and put them to work, is because they have to react and respond to a risk or a shock. And so if you're able to, if you have insurance to manage that cost, then you're able to keep children in school instead. We think about insurance in terms of having a protective side, which is managing risks, but also a productive side. And this is really helping people to, by putting a price tag on risk and helping people to not have to be setting money aside for a rainy day. They can make more investments, for example. But we also see farmers being able to have access to inputs that they wouldn't have otherwise. They would be investing in higher yield seeds because they're less worried about drought, for example. So there's huge contributions that insurance makes toward supporting entrepreneurship and economic development. And this is a really sort of underutilized perspective. People often think about the protective side, but really it's the productive side. We're trying to break the cycle of poverty. Having insurance is a key component. The ILO has been actively involved in supporting microinsurance development for a number of years, but most recently, over the past 5 years, with support from the Gates Foundation. And we've launched this Microinsurance Innovation Facility that has over 60 innovation partners experimenting with new ways to provide better insurance services to more low-income people. We've been gathering evidence of their experiences over the past 5 years, and we are sitting on a huge trove of good practices, things that you should do, things you should avoid doing. And so what we're planning to do next is to shift gears and really embark on a new strategy to roll out those lessons and get them into the hands of the organizations and companies that need them the most.